So this is our rotational plank. There's a couple little nuances of this. So the setup, the side that we're working on, we're gonna make sure that that thigh is coming in perpendicular to our body, right? So we don't want it too acute, we don't want it down too far. The back leg or the trail leg is really kind of not doing a whole lot in this drill. And then we're gonna try, if we can, to come down to the floor on the forearms. Now, if in this position, we can't get all the way to the ground because we're limited by mobility, we can do a couple things. We can come up to our hands, right? Or we could get ourselves on a box of some sort, or yoga blocks, so where you can be on the forearms, but elevated a little bit. So once we get set up here, the first couple cues we want to work on are creating intra-abdominal pressures, right? Blowing out that abdominal cavity, creating pressure 360 degrees. Second cue is driving the outside of this perpendicular knee into the ground, almost like I wanted to pick myself up. And now I'm going to try to turn my upper body away from this knee. So I'm thinking I'm trying to turn my upper body this way, but if I'm creating counterforce here, you're not going to be able to go very far. It's a great drill for mobilizing, in particular the TL junction, especially for scoliotic patients. Now I can start making this drill dynamic by actually driving force, creating some rotation or a feel of rotation, starting to lift that hip. Now as I lift my hip, I'm going to try to think that hip is going this way in space. So if Sloan can come over here and kind of look, what we want to stay away from is as I come up, is kind of crunching my hip together. I want to keep that hip long. So this would be where we don't want to go. We want that hip to stay long or going away from our head. So again, it's drive force into that knee, pick the hip up, drive the hip long, keep it out of that short crunch position. And that would be the dynamic portion of our rotational